Welcome back. Well, it's wonderful when you can have a world-class health facility right in your own backyard.
Yep, and we do. And there's something very exciting happening at Uconn Health. It's a national trial for Gliobastoma. Dr. Kevin Becker is the Director of Neuro-Oncology at Uconn and is leading this study. Doctor, thank you so much for being with us.
Thank you for having me. Nice to see you, Irene and Melissa.
Thank you. And we want to know, first of all, why is it so important for Uconn to be involved in something like this?
This is a study that is meant for patients with one of the most aggressive forms of brain tumors that there is. It's called a glioblastoma. And currently, the treatment for a tumor such as this consists of radiation and chemotherapy, although that has very limited benefits. The significant advantage of having a study for patients with a tumor such as a glioblastoma is that that gives them additional treatment options, which is something that is very unique. And in particular with this study, it is a very exciting study, has shown really promising results early on.
Well, doctor, tell us a little bit about the trial itself. What kinds of things will patients be undergoing while they're part of it?
The first step is they get in contact with us, and I can give you contact information towards the end. Then ultimately what will happen is I will meet with them and we go over the screening process as to whether they'd be eligible for the trial. This is a trial that is for recurrent glioblastoma. And then after that, what happens, basically the idea behind the trial is that we're trying to use the immune system to fight off the tumor cells. And the way that we are doing this, the way this trial is designed, is that we use a modified form of the polio virus. This is a form of virus that does not replicate, it is not pathogenic, meaning it's not infectious. And what happens is Dr. Balsara, who is also co-PI with me on the study, and he is the chief of neurosurgery, he will, in the operating room, infuse this virus into the surgical cavity and into the tumor tissue. Now, what that does is that causes an immune response where the immune system responds to the poliovirus that's within the tumor cells. Once that happens and the patient is discharged from the hospital, they're then given an infusion of a drug called Keytruda, which is a drug that stimulates the immune system even further. Again, the whole idea of the trial is to use the immune system to attack these tumor cells.
So this is really exciting information and an exciting study. And it sounds like this is one of a limited number of sites for this.
Yes, thank you for bringing that up. This is actually only a national trial as of now. And currently we're only one of 2 sites in the Northeast that has this. Very few sites and within the country actually have this trial at this time.
So, doctor, is this still something if somebody was, watching right now and thinking, oh, this is something that affects somebody I know, can they still reach out and be part of it?
Absolutely. Thank you for bringing that up. So, really my goal here is to both inform the public, the patients, as well as the community physicians to let them know that this very unique opportunity is available here at Uconn Health.
Is this something that can affect anybody at any age, or is it limited to a certain age group?
Right now in the United States, the average age for a tumor such as this is about 52 years of age. The vast majority of these cases are what we call sporadic, meaning it happens out of the blue. We have no idea why it happens. There's not a genetic predisposition per se that we're aware of, although there is other cases where that happens, but that is not the case for the large majority of patients.
And so have some people already gone through the trial and are already showing promising results on the other end?
Yes, as a matter of fact, there was a 60 Minutes piece done, actually, I think about 6 or 7 years ago on this exact trial. During the phase 1 aspect of it, it was done at the Preston Tisch Brain Tumor Center down at Duke. If anybody's interested, that's actually on YouTube. This is an extension of that trial. And the addition of that trial, what we've done now is then added this secondary drug that helps boost the immune system even further.
All right, Dr. Kevin Becker, we really appreciate you being with us. Just one last thing, and I know you were talking about this before. How can somebody get involved in this?
Yes, I have some contact information, and there's people that are standing by to speak with you. I can give you several numbers and also an email. So the first number would be for the Cancer Center. That would be 860-679-2100. So that's for the Cancer Center, and that would be for me. Or it can be through Dr. Bolsara's office in neurosurgery, and that would be 860-679-8080. And I can repeat that again if needed. And also, by the way, there's email. We're happy to respond to any email inquiries that may come across, and I can give you those as well. That would be K.E. Becker, all one word, at uch.edu, as well as Dr. Bolsara, which is B as in boy, ULSAR, at uchc.edu. And I would like to mention that the trial actually just formally opened as of today.
Oh, wow. Well, thank you
Excellent.
so
So
much,
we are
Doctor.
accepting
Really great
patients.
stuff. We're looking forward to learning more about it as time goes on. So we appreciate your time.
I really appreciate the opportunity to talk about this very, very exciting trial. Thank you so much.
All right, great. Thank you very much. And for more information, visit health.uconn.edu, and we'll have all the numbers that the doctor mentioned. We'll post all that information on betterct.com.
Yeah.